Hello, I am Z. I'm from group number 22. I'm going to be sharing with you a study we did in the Pretoria East on a community called the Plastic View. The study we did was about a humane community development, dog population management, One Health, and the welfare of these animals at large. I would like to introduce my group members. Stian Vessels, Tulani Saizi, Mohammed Isa, Vimbai Tetsimira, myself, Mziwonke Kakela. The team have tried to come up with possible solutions that are sustainable to mitigate the problem in Plastic View. Number one, we said that we would like to, would identify the sources of stray dogs, which is owned dogs that roam freely, dogs that have been abandoned by their owner, including puppies that result from uncontrolled breedings of these owned dogs, unowned dogs that reproduce successfully. Number two, education and legislation for responsible ownership. We provide something like licensing, community-led efforts to mitigate the problem, registration and identification of dogs. We could use tags, like maybe even ear tags, regulation of dog breeders, environmental controls. This requires steps that would make sure that the dogs are excluded from sources of food, rubbish, and installing animal-proof containers. Reproductive control. This one prevents the birth of unwanted puppies and can help address the balance between the demand for dogs and the size of the population. It is also advisable to focus on efforts to control reproduction of those individuals or groups in the dog population identified as the most productive and mostly likely to be the sources of unwanted and stray dogs. To ensure best use of resources, best methods of controlling will require direct veterinary input to individual animals, involvement of both private and public veterinary sections, may also be required to meet the demand for services. Subsidization of sterilization programs by the government or other organizations may be considered to encourage the uptake. The control of reproduction is essentially the responsibility of the owners and can be incorporated into the education and responsible ownership. Methods of controlling reproduction in dogs would include like your surgical sterilization, chemical sterilization, chemical contraceptives, separation of female dogs during estrus from unsterilized males. The last resort, which is what we would not consider, but if it calls for, it is going to be euthanasia. So when euthanasia is practiced, the general principle is the code should be followed, with emphasis on using the most practical, rapid, and humane methods and ensuring operator safety. Regardless of the method used, it is important to minimize distress, anxiety, and pain by ensuring that the operators are appropriately trained.
I would like to begin by describing a participatory approach. A participatory approach occurs when the community takes an intervention that was placed in response to its needs into its own hands. This also means that it will continuously improve on those actions through active participation. Stakeholders such as the government, municipalities, NGOs, and veterinary sectors all play a critical role in sustainable participation. The government and municipalities' roles as stakeholders mean that their actions greatly influence the community's sustained participation. Subsidization of outreaches, for example, will help provide sterilization and vaccination services to the foreign nationals, animals who cannot otherwise, without documentation, receive it. This will then build the community's eagerness in becoming more involved in these necessary changes and build a sense of unity. Our ability to effectively communicate with the community by identifying individuals who can help translate between English and the community's primary languages will help the community by increasing their willingness to communicate problem areas, thus building a partnership through active participation. It is thus very important to communicate with the community on a consistent basis to keep up with any changes in needs and what they feel they are willing to contribute. Next, I will describe asset-based approaches. An asset-based approach mobilizes existing assets, such as leaders or groups within the community, to identify and develop their strengths and create new ideas that will benefit the community. Sometimes these are not immediately apparent, and the community will need to learn to identify these in order to direct itself towards positive change. For example, several individuals called upon the university and researchers to take action with regards to dog population management in Plastic View. These same individuals have common interests in mind and are able to come to a rough consensus on possible solutions with regards to dog population management. Thus, their joining each other and creating an organization within the community will help the community towards positive change. The use of two distinct languages, that being Shona and Sesotho, means that the people have another commonality, which allows them to effectively communicate and learn from each other. Although the two languages are different, individuals who are willing to learn and understand and can speak both are powerful in uniting the community. Stakeholders and their abilities to subsidize any projects created by the community promote sustainability of those projects and will aid the community in learning to become more self-motivated and self-reliant. It is surely a long-term investment that will see many positive changes occurring within the community.
I'd like to begin by talking about primary animal health care. Animal health care involves providing animals with health care that is essential to their health and well-being. When talking about animal health care, one tends to think that the veterinarian is only responsible for animal health care, whereas the entire community is responsible for animal health care. In the community of Plastic View, there are many dogs that run about in the community. Some residents suggest that these dogs be taken away as they can be aggressive. There are others who want the dogs there. There are dogs that are owned by individuals, and these individuals show affection to their dogs. And in other cases, there are dogs that are used for hunting. And in other cases, there are individuals who own dogs for the sake of owning them. The problem with garbage disposal, broken fences, etc. pose a problem for these dogs that live freely within the community. The common denominator in many of these cases is that many of these dogs are not fed properly, and many of these dogs live in squalid condition. Possible solutions to these problems include population control, this will be discussed later, the state stepping in, providing animal health care, and in my opinion, most importantly, educating the community on primary animal health care. Moving on to the concept of One Health. This is a collaborative effort involving multiple disciplines with the goal of achieving optimal health outcomes in the environment, for humans, and for animals. Let's discuss One Health within the community of Plastic View. Now, I've already talked about the garbage disposal problem. This already violates one of the tenets of One Health. If there's garbage lying around, this affects animal health as well as human health. And if animal health is affected, then human health will be affected, and then vice versa. Possible problems to achieving One Health goal is collaboration from the government, health sector, agricultural sector, and the built environment sector. These sectors need to come into the community of Plastic View, educate the people on One Health, and provide viable solutions to the problem. Lastly, we will talk about the dog population management. I have already mentioned that there are many dogs without owners that run about in the community of Plastic View. The problem that these free-roaming dogs pose is that they can be a danger to the residents of Plastic View, and also the fact that they are in poor condition. Possible solutions to controlling the dog population is stamping out, culling, and sterilization. These solutions come with their own disadvantages. The disadvantages of culling include losing support of the community due to the dogs being desired or at least tolerated. Then dogs can reproduce faster than they can be culled. Dogs migrate from elsewhere back into the community, and killing of vaccinated dogs can reduce herd immunity. The disadvantages of sterilization programs include sterilization is expensive. There are very few successful sterilization programs, and to really make a difference, a large amount of the population needs to be sterilized.
Humane community development. provide a framework for communities in which they can participate to work together to find sustainable humane solutions to dog issues which have a negative impact on the people and animals of the community. The main challenge is the fact that dog owners were previously requested for proof of ownership of the dogs in order to vaccinate them or to spay the animals. We believe that there is opportunities in the community where the university can contribute to the humane development. We believe that the university can perform spay campaigns and rabies vaccination campaigns without these documents being requested, and thus by doing so the dog populations can be controlled in the community. If the people are aware that they will not be required to present papers that prove the ownership of the dogs, they will be motivated to participate in such campaigns, leading to collaboration in the community to work towards a better, more safe and humanely community by taking hands with people from the community and other external bodies such as the Department of Health, Water and Sanitation, Sport and Recreation, Agriculture and Forestry, including Veterinary Services and the University of Pretoria. Humane education. According to Muketsi, it seems that there are people in the community that care for their dogs and share great compassion towards them. On the other hand, there are some owners that have 16 dogs and don't feed them or give them any attention. This is where the university can have a great impact by teaching humane principles towards the community. Basics such as you must feed your dogs, give them love, take them for a walk, etc. This seems obvious but not for these people. Ethics. During the community engagement, it was mentioned that the people are willing to participate in such campaigns. However, they are frustrated as they say that the organizations always gather information about how they can contribute and then they never come back to fulfill their promises. The community will be eager to participate if the university is to formulate a plan and then see the plan throughout.
Hi, I'll be highlighting the risks, mitigation of the risks, a transdisciplinary approach in dog population management and rabies control. The Plastic View informal settlement in Pretoria East have an increasing numbers of free-roaming dogs. A rapid increase in dog population poses several risks to the community and to the country at large. These dogs are uncontrolled, hence increasing chances of dog-mediated human rabies, especially in kids. It was noted that people without legal documentation had no access to the free rabies vaccination campaigns. Discriminate vaccination programs potentiate the virus to be endemic in the country. More so, this rapid increase in dog population might cause a financial burden to the government and animal facilities should sporadic spreading of the virus occur. Tracking and monitoring of real dog numbers or population dynamics might be hard to attain due to the fact that there is a rapid increase in dog numbers. A transdisciplinary approach towards counteracting the risks is the best way in combating the rabies virus in the long run. This should be comprised of the community, the government, the vet and the paraveterinary professionals, and the private sector. A government with an ambiguous expression of political will towards the control of rabies will assist in controlling rabies. The private sector, for instance, the pharmaceutical companies can invest in various rabies campaigns. This will ensure that the prices are lowered down and there is sufficient vaccines, quality vaccines available. Vet and veterinary students can assist to this cause by educating the children on safe behavior around animals and animal caring. People who are immune to the virus can contribute also by donating plasma. This will contribute to a larger extent towards pre-exposure prophylaxis. Last but not least, the community can contribute to this cause as well by exercising responsible dog ownership skills by bringing their dogs for vaccination, just to mention a few.